Have you ever wondered why flight teams and critical care transport teams use a nurse and a paramedic at the same time? Well, it's because they think completely differently. Here's the reasoning behind using both specialties. So, a paramedic is so incredibly good at emergency situations. Their brain thinks in algorithmic ways. They know that this is the problem and this is the fix and this is how we get to that fix. They work incredibly well under stressful, pressure situations. Nurses, on the other hand, are not as algorithmic based, but their thought process is a very different process to what the paramedic does. If you're coming straight from nursing, you have no EMS experience, you bring the critical care thinking that the paramedic may not have. That 5, 6, even 7 steps ahead of what's going on currently, you're already thinking about what's going to happen then. What does that mean? A nurse goes, this is the problem, and if I give this fix, is it going to help them, hurt them in the long run? This is why both brains work so well together, because the paramedic is there to fix the life threats. If there's something wrong, they know the fix. The nurse is there to think 10 steps ahead on that critical care level. They're currently thinking about, well, if I give this med, what's going to happen 10 steps down the road? It's a really important process for both of them to be working together. And as they both gain experience in these different areas, you'll see this melding or meshing of this thought process. And it's one of the most impressive things in the world because it leads to amazing critical care patient care. Because honestly, the butting heads of paramedics versus nurses, it's ridiculous. We both do different things, and we both do different things really, really well. So if we put our heads together, we're one incredible force of nature, which is why flight teams work so incredibly well.